Let's go to Trans Nzoia County. Colin Shitabai is there, the Kitale County Hospital. Are the nurses on strike, or what are they thinking this morning?
Yeah, very good morning. Sam Gituku here from Kitale town in Trans Nzoia County. Health services in Kitale County Referral Hospital has been paralyzed, and other health facility, about 101 health facility across Trans Nzoia County, have been paralyzed because nurses have officially started their strike today. Top on their demand is lack of proper equipment to undertake their professional work, and also they are complaining lack of sufficient medicine and drugs in all those facilities. To put us in that perspective, I'll be talking to Willie Sifuna, Secretary of Nurses Union in Trans Nzoia County, who will also tell us what are their plans. Have they officially started their strike? Have they been negotiating with Trans Nzoia County government officials? Mr. Sifuna, have you negotiated with county officials, and what are your demands?
We have tried to negotiate with the county officials, but they are adamant. They are not committed to meeting our demands. Somebody like CEC Health, she has refused completely to give audience to the union. And therefore, we have negotiated with the CS, with the other team, but they have not taken our issues seriously. At Trans Nzoia here, we are suffering because there are no equipments, there are no non-pharmaceutical, non-farms, there are no drugs, because of poor management which are being given by the county management. You find that in the health sector in Trans Nzoia, we require 150 million per quarter to meet all those drugs and non-pharmaceuticals. But I can assure the public that the only amount which was allocated to non-farms and drugs was in October and was 29 million, and we spent those drugs within less than 1 month. And what now we are saying, we cannot just sit in the hospital doing nothing and the patients are suffering. Now what the management is doing is twisting the workers through intimidating them through transfers and threatening them because they have failed to deliver, so that we cannot say. We are saying for the last 6 years, which we have been in devolution, there is no proper system in Trans Nzoia County to manage health. Most of the workers are handpicked. They are handpicked to suit the interest of those who have handpicked them. So we are saying we want proper systems so that we can operate as professionals. Most of the people who are handpicked, they don't meet the requirements of the staffing norms. So what we are saying, we don't want sycophants and political sycophants to lead us as professionals. So we want people who are professionals to lead us. Now from the county, we cannot be given a teacher to be a CEC. What vision shall he give to the health sector? We cannot be given a chief officer to be an engineer. So what we are saying, we want the health system to be restructured and be given the right people in the right place to work, so that we can go back to work. At the moment, we are out until they meet our demands, so that we can go back. Otherwise, the 104 health facilities in Trans Nzoia are paralyzed until they meet their demands.
Okay, Mr. Cheriot, can you tell us, are you still negotiating with the county government to ensure that patient does not suffer during your strike?
Okay, the information from our General Secretary is very clear that negotiations were over, and what we want now is implementation of our return to work agreement, failure to which no nurse shall return on duty until there is full implementation of our return to work agreement. But we are saying the only negotiation we can do is for the county administration to tell us when are they paying us our money, when are they addressing the rest of our demands. So we are open to negotiations, but the only negotiation we are doing is how are they going to pay us our allowances, and how are they going to address shortages of staff, shortages of drugs, shortages of non-farms, and the punitive drug transfers that we have highlighted.
Asante. Mimi naitwa Samuel Kiboi, mwenyekiti wa County Government Workers Union. I do support this strike kwa sababu kaunti yetu ya Trans Nzoia ni kaunti ambaye haiwezi kusikia chochote, maana hata mkimpa barua hakuna wakati itakapojibu. Maana kama upungufu wa wafanyikazi katika kaunti hii ni Public Service Board inayestahilika kuweza kuleta ya kwamba kuna shortage ya wafanyikazi. Lakini kufika sasa board yenyewe haiwezi kushughulikia, maana naona ni tamu yao imeisha. Na tunaomba ya kwamba kaunti hii ikaweze kusikiza matakwa ya wafanyikazi na wawe friendly na wafanyikazi, maana unionists are not enemies, na wamechukua wafanyikazi kama ni maadui wanapodai haki yao. So tunaomba ya kwamba kaunti hii ikaweze kuajiri nurses inavyostahilika, ikaajiri wafanyikazi katika idara zote, ili tuone ya kwamba kazi inafanywa, maana hatutaki kuongoza wafu, maana kila wiki tunaenda kusika watu kwa ajili ya ukosefu wa dawa. Na hii ambaye imetokana ni kwamba ni waziri aliyo na utepetevu. Wacha gavana wetu asikia ya kwamba tumekataa utepetevu katika kazi kama waziri, pamoja na injinia wake ambaye alimleta. Arejeshe injinia kwa kazi ya matingatinga na akapeleke huyu katika mambo ya chokaa. So ili kazi ya hospitali ikaweze kufanya. Hatuwezi kurudi nyuma, tutasupport mpaka wakati watakapotimiza mambo hayo. Asante sana.
Well, some Gituki, it is a story that I'm following up here from Trans Nzoia County. Later in our program, Semana Citizen, I'll be talking to Deputy Governor Stanley Tarus Kenei to tell us how far have they gone to ensure that these nurses go back to work and patients don't suffer from this strike. From Kitale, I'm Collins. Back to you, Sam Gituku.